I was born and raised in Lebanon. I went to medical school at the American University of Beirut, graduated in 2001, and came to the States to do further training in pediatric residency and fellowship. I'm really excited about the partnership with the American University of Beirut. Being a graduate from the American University, that was a perfect time for me to give back to the school, as well as try to help our current home to build these global relationships.
Each trip is about between 7 to 9 days. The surgery is between 10 to 15. The surgery can be any from atrial septal defect closer to more complex surgery, for example, arterial switch or total venous anomaly. We almost do everything what we could done here in the United States.
Our hope for the collaboration between IU and AUB is to be on multiple levels. We definitely want to continue to do the humanitarian work. We also want to grow the academic collaboration. Our hope is to exchange students, residents, and open opportunities for faculty development and support the two hospitals, whether on infectious control, training of their nurses through sim work, or actual work on, for example, ECMO. So I think, this collaboration has room to grow, and it is very exciting because we can, make it include multiple aspects, including education, humanitarian, and hospital administration.
I think always one of the challenges is we have to think about the next step if something go wrong when we don't have the same exact team. We were lucky enough to have some of our nurses, some of our OR team to go, but it's still, we're not in the same setting here at Riley. So be prepared for the worst and able to manage any complication with the resources you have is another whole set of skills we gain when we go there. So I think this is probably the most challenging part of going there. Even as a surgeon and a cardiologist planning for a surgery, they may have a different plan than what we would have here for a kid who's going to go back to refugee camp or do not have access for anticoagulation similar to what we do here in the United States.
When our students and residents visit AUB, our hope is for them to be able to fully integrate it in the system. So Lebanon is unique in a sense that there's a huge refugee population, and already AUB has partnership with the UN, and they have a lot of well-established programs in the refugee areas. So that will be a great opportunity for our residents to be able to work with the refugee population. In addition, there are some pockets in Lebanon where there are a high incidence of consanguineous marriages, and so there is a lot of pathology that our residents will be exposed to there that we don't normally see here. There's a higher incidence of thalassemia, for example, multiple congenital anomalies that we don't normally see. Just seeing the Middle Eastern population in Beirut, Lebanon, will expand their medical knowledge.
I think for me, I really think the two major areas of this trip is humanitarian work. This is a very rewarding work for a lot of us as a pediatrician and as a physician to go and treat the kids who does not have resources. And the second part is the educational work.
Not only we can give back to their country by educating them and giving them more training in here, but also it will be beneficial for our residents to see somebody from other cultures and learn from their experiences and learn about their culture. I think it will expand our thinking, and it will be of great value to our residents and our trainees.